Thank you very much, everybody. Thank you for inviting me. I'm very pleased to be here to give a perspective from a lived experiential perspective of mobile technologies and the value they can bring to living with a chronic condition. So, just to give you a bit of context, I was diagnosed with type 1 diabetes at the age of 45 last January. It's a chronic condition. There's no known reason for it happening. It can strike at any time, and once you have it, there is no cure. You spend the rest of your life testing your blood and taking insulin to stay alive. So believe me, it can happen to anybody at any time. One of the consequences of living with a chronic condition is the social isolation that it brings. You're typically the only person you know, either in your family or in your peer group, with a condition. So you are genuinely isolated, both mentally, physically, spiritually, and in terms of the health literacy that you need to understand not only the management of a chronic condition, but living day to day with something that simply will never ever go away. One of the things that the modern world has brought to us, and I echo Joanne's statement, is the proliferation of social media and the use of the internet. So it's incredibly easy as a Western educated citizen to access information that describes the technicalities of a disease. It's much less easy to find people to help you live with a chronic condition and explain to you how to achieve the sorts of control that you would like to live, the life that you would like to lead. So again, if we go back through the last 1,000 years of healthcare, we moved from a world where the doctor would bash you over the head with a rock to get rid of the pain in your foot, and into a world, because it would distract you from the pain in your foot because you've now got a pain in your head, and into a world where men in white coats tell you what to do, and you accept without question exactly what they say because they've spent their lives learning to be experts in your condition. And now into a world where information as knowledge is freely available to most citizens, and our ability to access that knowledge means that we're able to raise our own level of health literacy. And so there's an opportunity for the healthcare professionals to become more guides than gods. They can mentor and assist us in accessing and signposting us to the tools and the technologies that we need to live with our chronic conditions. And as such, they necessarily then free themselves up to concentrate more on delivering care to the acute patients who need a lot of intervention to help them manage. And without the use of technology and without the proliferation of media, social media and smartphones, these opportunities wouldn't be presenting themselves. So from a policy context and from the sorts of work that you people do here, I would urge you to think very, very carefully about how to utilise the quite clear benefits that there are in mobile technologies. I'll give you a very simple case in point. I can go into any shop pretty much on the planet, any mobile shop, and buy one of these very pretty devices from a company that has a symbol of a fruit. And it has no instruction manual. I open a beautiful little box, I take out a beautiful little device, I switch it on, and it works. And it connects me to a worldwide economy, community, telephone infrastructure, and the opportunity to engage with games and apps and business. I can do absolutely anything I want with the life I choose to live with one of these devices. It's fantastic, except health. If I want to talk today to my healthcare team in the UK, and if I want to send them data from a medical device that's attached to me, so this is a Dexcom blood glucose sensor. It continuously monitors my blood and gives me a trace to tell me if I'm safe. If I was having a problem right now, I couldn't send this data via this phone to my healthcare team in England, because I'd be breaking all sorts of rules, regulations, and local legislative framework. And yet, I can pick this phone up and make a trade and sell stocks in Tokyo and buy them in New York. Why is that? Why are the rules and the regulations prohibiting the citizen from being active participants in their own healthcare? in quantifying themselves and taking a personal responsibility for managing our own health. We all want to live better lives. We don't like being ill. We like having adventures. We like living to the full. We want to be constructive and positive contributors to society. The system, in a large way, is actively promoting us being a net drain on society because of the costs that we're continuing to incur with the increasing rise in obesity, sedentary lifestyles, type 2 diabetes, and other chronic conditions. There are technologies out there right now that could fundamentally change the landscape for healthcare. And you people here in the EU, you legislators and policymakers and influencers, are the people that need to do this. You need to be excellent at what you do, because the decisions that you make and the conversations that you have make my life worth living. So I implore you, learn from the mobile world health regulators and policymakers, but I've also put in a word of caution to the mobile world. Patients are not consumers. We're people. There is a similarity in economic language that is used to discuss the numbers in health as there is in the consumer and the retail business. There is a fundamental difference. One of my alarms going off right now. The difference is that health is much like religion. It has to be personal. It has to be meaningful to the individual. If change and behavioural change, whole-scale population change, is to be sustainable, it has to mean something to the individual, not just be a policy statement. So there is an opportunity with social media, with mobile technologies, to address the individual. Uniquely in human history, we have the technology to interact at a very personal level with pretty much every citizen on the planet. That's something that is incredibly powerful. At the same time, it brings great risk. So the health world can learn about innovation, rapid deployment. It can learn about how to make things simple to use. Again, back to the analogy. One little pretty piece of equipment in one little box, absolutely no instructions. This, because it's a medical device, came with a box the size of a breeze block, building block, and 400 pages of instructions, and it has a fraction of the capability of this device. And again, that's because of the regulatory framework. These are things that you can do something about. So think carefully. Final word of caution to the mobile industry and to those of you that get very excited about apps and rapid deployment and behavioural change. In terms of diabetes, ask yourself this question when developing policy and when developing behavioural change frameworks. If 100 years of a set of bathroom scales and a mirror haven't changed human behaviour in terms of how they address growing obesity, why will a mobile app change people's behaviour? So whatever it is that you do, make it meaningful, make it sustainable, and make it something people want to do, not something that they're told to do. And then we can live longer, healthier lives and be net contributors to society and not break global health economies, as we're all being told we're going to do. So thank you very much for your time. I'm very pleased to take questions.